are almost ready to go. You can see they've just got it all gloved up. The area is ready to go. And now we're going to be getting in there and seeing what we can see. So hopefully, like I said, probably the best case scenario for us today would be that the infection is on the outside of her trachea. There's also something called a synex as well, and that's basically like a voice box for birds. And theirs is a little bit different. Our voice box is quite high up in our esophagus, in our trachea, sorry. And basically right up here, with the bird, it's actually right down low at the first branch of the trachea. So when it goes down to the lungs, it branches in half, and then it goes into other lungs, and it branches lots and lots and lots of times. The voice box on a bird is right at that first branch, so it's quite a lot lower. And basically that either means the infection is on the outside spreading down, or worst case scenario, the infection is at the bottom of the lungs and spreading up through. So if it's spreading up through inside the lungs, it's going to be quite a lot harder to treat. If it's on the outside, it's going to be a lot easier to treat. Probably get a tiny bit off of it and it'll be a lot less invasive. So fingers crossed, it is one of those things. If she does have any issues, respiratory issues, we're looking at two things possibly for the video, or also aspergillosis. And aspergillosis is quite a scary disease. What it is caused by fungus spores in the ear. They're always present in the ear, and the birds can fight them off naturally. But if a bird gets a little bit stressed out, it might get a little bit sick, maybe another bird starts to dominate it a little bit. They get stressed and immunocompromised, and then those spores can actually take hold and they can get a little bit of that disease. And once they do have it, it is a very long treatment to get rid of it. So fingers crossed it's not, but we will soon find out. For those who have just turned up, this is a rainbow Larikeet, and her name is Timber. She's quite special because she works with us on the training team, and she's a real character. And she stopped talking the last couple of days, so we figured something was up. Done some blood tests, found that her white blood cell count was really high, which probably indicates towards some sort of infection. And with the loss of voice, it really indicates towards respiratory infection. And so today we're going to be doing a little tiny bit of surgery. I definitely can't say the word again. Endoscopy. I really am having trouble with that word today. I just cannot get it. Endoscopy. That's the one. And so basically what that is a very tiny little camera, and inserted through a little tiny cut on the side of her chest there, and it'll go up to the chest cavity so we can have a look at the external side of those organs and then find out if we can see any infection. And if we can see any infection on the outside, which would be the best case scenario, get a little piece of that spore or that infection and do a biopsy there so we can find out exactly what it is, and then we can go ahead and treat it. So the sooner the better would be good.
The dude wakes up with camera.